Hi, I'm Dr. Karen Harum, and today's blog actually addresses the ways in which we diagnose ADHD in children and the accuracy of some of those methods. Well, in my practice, it sometimes occurs that kids will present with a history of ADHD, but they actually have something else. Or maybe they have other non-psychiatric diagnosis. Maybe they just have no diagnosis at all. Many times, the medications for ADHD that kids are on will worsen the picture of the ADHD symptoms, and these kids are actually worse on standard medications. So it's really important to get an accurate diagnosis and to understand your child as an individual. So an accurate diagnosis takes a little bit of legwork. Not only the standardized questionnaires that are specific for ADHD need to be completed, but there are other questionnaires as well that will survey things like mood or social skills and even conduct disorder or bad conduct. And in addition, a structured interview is required along with a neurological examination. So we need to understand all of these facets, the questionnaires for ADHD as well as other behaviors, a good diagnostic interview and a good neurologic examination. Those are required to really understand the child. I once made a diagnosis of a movement disorder in a little girl who was diagnosed with ADHD because she was so hyperactive. She literally couldn't sit still, but the quality of her movements were so different that the diagnosis actually was not ADHD, it was a movement disorder. So it takes a skilled eye to sometimes see the difference. Because there is really no good biological blood test or x-ray study that can be done to diagnose ADHD, it's important to talk to your pediatrician or developmental pediatrician and to ask for these standardized questionnaires. Find a provider that can administer a computer test of continuous performance to actually measure your child's attention span. That's an excellent test, very excellent clarity in diagnosis. And usually children as young as 5 or 6 can complete one of those continuous performance tests. Unfortunately, some parents go to the pediatrician and they don't always get taken seriously by their doctor, and so sometimes the diagnosis is delayed. On the other hand, sometimes parents' concerns are kind of overinterpreted, and the child might just be going through a rough patch that needs to be addressed with counseling. And I'd rather, again, we get an accurate diagnosis rather than slap a label of ADHD on that. Well, let me give you a recent example. An adorable 7-year-old in my practice recently experienced divorce in her family. And her naturally high energy and impulsive creativity sort of took a turn toward the turbulent side of stress, and she became irritable, difficult to settle, off task, and also activated physically. Well, recognizing this for what it is, which is really just an emotionally turbulent setback, allowed us to avoid the Band-Aid approach to treating ADHD. It really directed us toward true healing with a combination of counseling, calming neurotransmitter support, which we'll talk about more in the future, and even some lavender spray to her pillow each night to facilitate sleep. In addition, her mom wisely simplified her schedule, and her home was instilled with calming music and calming aromas, and she's now back on track. I think we avoided the Band-Aid medication approach to a diagnosis of ADHD, which really wasn't a good fit for her. A proper diagnosis can really take longer, may take more legwork on your end, but it's going to save you years of heartache down the road, and it's really going to truly impact your child's behaviors even well into adulthood. The brain can be healed, and it can function better, but it takes an accurate diagnosis and a good, clear starting point. So if you're struggling with hyperactive, inattention children that are defiant and overstimulated, I want you to seek out the best assessment you can find with either a clinical psychologist or a developmental pediatrician. Lay this foundation first, then check back on this blog for further information on healing the brain and restoring peace in your home. Join us also on July 11th at 7 p.m. We have a free live webinar where you can ask me specific questions about your unique circumstances. And be sure to register for this webinar at the link on vibrantchildren.wordpress.com. Thanks for being with us today, and join us again the next time.